This is a lesson for all of you. See, whenever, first of all, IVF pickups are a cold case. It's not an emergency, but it is make or break for the patient. A needle can go anywhere. Needle is made up of stainless steel. It can go anywhere, isn't it? Needle you can take anywhere. But remember that in case you don't use a needle properly, like a monkey using a blade, cutting everything. When we see ourselves entering a plane, the needle can reach anywhere, no? But we have to see that in case we are getting some tissues in between, we stop. Just remember that whenever you do such a case, there is somebody waiting for you at home. You do this case, say I was in the army hospital where I had to do it. The tertiary most hospital of the country I was working at, doing 150 pickups a month with embryology. So I had to do every case because in case I won't do, nobody else is there to do that case. So what happens? When I do such a case, I will probably take the consent of the neurosurgeon. I'll talk to the hematologist, but कर रहा हूँ ऐसा case difficult है, तो उनको so it's a combined shared decision we take. But you people are having your own units. In case you do a bad case, what will happen? She'll go into peritonitis. Maybe peritonitis. Maybe nothing will happen. Maybe peritonitis. Maybe hemorrhage. Maybe anything. And anything happens to a perfectly healthy girl, amounting to the admission in the ICU with peritonitis or intestinal obstruction. Maybe you have injured the omentum or bowel. How do you know that bowel is not moving towards that area? Then what happens? She goes into ICU for 3-4 days. A clear-cut case, we have done a problem, and then you will become news of the state. It will happen. We have done a complication. So nobody will appreciate that you are doing a case which was difficult for you to do. Nobody will appreciate that. They will say that you have spoiled a case. Then starts her admissions, and then it starts litigations, and then what happens? Who will be affected in this?
Both family will be.
Your husbands are affected in this. Your children are affected into this. For a decision which was not a shared decision, you guys take a shared decision, do anything. But because you have a needle in your hand and you can perforate for sake of getting one egg, because the 3 doctors are together, okay, we'll take a chance. Then it's a shared decision. In an organization, maybe a big corporate hospital, it's a shared decision. But doing it alone in your places, it is not the right thing to do, because any surgeries you do, just think that you are answerable to your families. You got husband at home, children at home, then for next 6 months, for initial 6-7 days, it will ICU in, ICU out. What will happen? In case you do a bowel injury, what will happen? Peritonitis. Then it will be expectant management, conservative management, then tenderness, guarding, now laparoscopy or laparotomy, then post-operative care. For a mistake which you have done to get one egg,
We have to answerable for the patient also, sir. They will also.
I'm just saying, that's what I'm saying, that patient, the biggest thing is the patient only. I'm talking patient only. If you ask patient that is it worthwhile or not, what will the patient say? Madam, mat karna. A long time back. Again, lesson of life number 2. Lesson of life number 2 is very important.